Okay, we are live. You can go ahead and start.
Awesome. Thank you, Dana. And I will pass it to Jen to read our opening script.
Great. Today is May 21st, 2026. The time is 12:04. This meeting of the Greater Boroughs Partnership for Health, also known as GBPH, is now called to order. My name is Jennifer Sullivan. I am the Vice Chair for the Greater Boroughs Partnership for Health. The open meeting of the Greater Boroughs Partnership for Health is being conducted remotely consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Greater Boroughs Partnership for Health are allowed to participate remotely. The Act allows Greater Boroughs Partnership for Health to meet remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view this live stream or the recording of this meeting may do so by going to Northborough Media Connection on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. The Vice Chair confirms that all Commission members and anticipated agenda participants are present remotely and can be heard. When I call your name, please respond to the affirmative. Maria?
Here.
Yeah, Marie?
Present.
Isabella?
Here.
And Jen? Here.
Perfect. Thank you, Jen. So now we will pass it to Eliza and Donna to start off the strategic discussion.
All right, thanks, Michaela, and good to be with you all again before this holiday weekend. Appreciate you all taking time to be with us for our first strategic discussion. So, John, if you go to the next couple slides, this is our agenda for today. We won't do full introductions or go around or anything like that, but you're welcome if you'd like to pop in the chat, maybe something you're looking forward to this weekend. You're welcome to do that. I know I have some spring cleaning planned that I'm very excited about. So looking forward to that. But our plan for today, we have a pretty packed agenda for the next couple hours. We're going to be working through our 3 priority areas. And by the end of today, we're hoping to have draft goal statements and a brainstorm of ideas for each of those 3 priority areas. So we'll walk through the process for developing the plan for today in our next session. But that is our plan. I will note we'll have a 15-minute break around 1:05, and I believe during the first 5 minutes of that, Michaela will lead you through on voting on a few key issues. So just a note there. But otherwise, we totally encourage if you need to eat something. I know we're meeting over potentially the lunch hour. Please feel free to do that. If you need to take a stretch break, any of those things, you are welcome to do that throughout. In terms of, I think we shared this in our last meeting, but we have these ground rules we like to use. So encouraging people to trust the process, to listen and respect the diverse groups, diverse views. We're not working by priority area group, but diverse views in this group, to focus on one priority area at a time. So you'll definitely see that there'll be things that are related to each other, and you might have ideas about one priority area while working on another, but we encourage folks to kind of work through one at a time. And then we can always flag areas for cross collaboration of like, this is funding sustainability, but there's also a communication aspect. We can definitely flag those things. We definitely encourage balancing aspiration with a manageable scope. So wanting to be lofty and think big, but also really think about what's going to be realistic given all of the other work that you're doing and other priorities that you have. Encourage folks to build on each other's ideas, to honor and respect the work that has preceded your participation. That'll be more relevant the next strategic discussion for those who might be joining who weren't able to be here this time. So we encourage people to kind of jump in where they are and go with the flow. And then we always encourage to speak from your own experience and be kind to yourself and others. Is there anything that anyone would like to add? Otherwise, you can give a thumbs up of some variety if you're good with these moving forward. All right, sounds good. Okay, I think that I'm passing to you to kind of walk through the process overview.
Happy to. Thanks so much, Eliza, and good morning. Good to see you all again. Oh, it's afternoon now. Good afternoon. This slide shows the components. As Eliza just mentioned, we'll be developing several of these between today's strategic discussion and our next session. So in the building of the strategic plan, you have a vision and mission in place. We've established priority areas. Now we're moving into the meat of the plan, the goals, the objectives and success measures, and the strategies. So the priority areas have kind of created those umbrellas under which we've identified areas we need to focus on in the coming years. Goals describe very broadly what we're going to do under each priority area. I like to think of them as mini vision statements. It's where do we want to get to in terms of our entity and what we'd like to accomplish under each of these priority areas. Objectives describe how we know how much we're going to do and how we know we'll be successful. So, and then strategies are how we're actually going to implement each objective. So the goals are the really big what, the objectives are a little bit more specific, and then strategies start getting into the how of that. Our three priority areas, as you'll recall, are engagement and communication, funding and sustainability, and programming and structure. We shared Eliza shared a handout with everyone in advance of today's session, so we encourage you to refer to that. You may want to have it up on your screen next to this meeting, or if you've had a chance to print it out, for those of us who archaically still have printers in our homes. But I'll briefly go through from the key findings presentation what's included under each of these, and this is the same information that is included on that handout that Eliza shared with you. So under engagement and communication, the topic areas, when we start talking about objectives and strategies, the topic areas are the Greater Boroughs Health and then local health department communication roles and responsibilities, building trust with the community, awareness and promotion of Greater Boroughs, and improved communication and engagement across town partners, town leadership, and community members. So these are the types of things that in the key findings summary came out as areas where, not that we're doing poorly, but where we could do even better. Under funding and sustainability, the potential topic areas are planning for sustainability, very important for every organization, including a suggestion was to have something in there around a formula for sharing potential staff and services between towns. That was something that came out as would be very nice to have or continue having. Also, funding and sustainability includes utilizing available funding with partners, within parameters, understanding approval processes and parameters, and pursuing additional grant funding and fiscal tools. So these are all things that will help us have the funding that we need to do the work that we want to do, as well as sustain the efforts that we put in place. And last but not least is programming and structure. The potential topics under this priority area include explore expanding programming and public education. People want more of what you're already doing well. Accessibility of services for things like meeting people where they're at. What languages do we offer services in? Equitable distribution of resources between the communities. Explore additional opportunities to increase staffing, and then establishing practices and protocols for a variety of the types of work that the partnership does. So regional work, threat response, capacity and workforce, and responding to urgent needs. So not that you're not already doing some of these things very well, but how do we have something written down that that we can follow and that folks can look to provide that consistency. So those are the topic areas under the three priority areas. If you have any questions, again, feel free to ask as we're going throughout the facilitation this afternoon, but also refer to that one-page handout that we shared with you. So when we showed that inverted pyramid that has goals, objectives, and strategies on it. We just want to share a little bit about our definitions for those. As you know, if you've ever participated in more than one strategic planning effort, everybody's got their own nomenclature. So some people call objectives what we would call a goal. Some people call strategies what we would call an objective. So we want to make sure that the nomenclature that we'll be using with you today and in the next strategic discussion as we work with you to develop your plan, that we're all in agreement on that. So HRIA defines a goal as a broadly stated, non-measurable change in the priority area. So if you've heard people talk about how important it is to have a SMART goal, we have SMART objectives. Goals we look at a little bit differently. So in terms of this, again, it's broadly stated, non-measurable change in the priority area describes that desired outcome or that place you're trying to get to for that priority area. So goals are intentionally very global in nature. They provide general direction, but don't have to be quantified. They're intended to be long-term, and they can be, this is a place where we'll let you be lofty and idealistic. You'll hear a lot from us later on about, could you be more specific? In a goal statement, we really want it to be lofty and idealistic, and it's not necessarily that you're going to achieve the goal, but this is your guiding star for each priority area of where you're trying to go. As it was once said, if you don't know where you're going, any road will get you there. This goal is defining where we want to go so that we know what direction to head in. So we've got an example we'll build over these next couple of definition slides. We've used travel as a priority area, something that's hopefully relatable to most folks. So our family will see more of our country and experience other cultures. Very general, very lofty, very non-specific, non-measurable. It's just, hey, we want to get out there, travel more, see the world, specifically our country. So we're going to be developing one draft goal statement for each priority area. And we'll be working on those throughout the course of today. So then how are objectives different from goals? So objectives are how much of what we hope to accomplish and by when. So this is where we start getting more specific. So what do you need to change from the way things are today to get to where you want to be in that goal statement? So they're both describe the what. Goals are broad. Our objectives are much more specific and precise. So characteristics of objectives are things that usually start with words like increase, decrease, enhance, improve. We intend for them to be measurable, and we intend for them to be time bound. And as we're working through this, each priority area will have 3 to 5 objective statements for its goal. So that means you'll have 9 to 15 objective statements across the plan. Success measures measure the progress or completion of a goal or an objective. So what's the impact? What has the impact been on your statements, on your goal? So we look at things like, how many people participated in an activity? What do the exit surveys look like in terms of how much people learned from an educational event? So it's not, did we do what we said we were going to do? It's, we did what we said we were going to do. What happened because of that? What changed because we did it? So an objective example with a success measure is our family will take a trip in the United States every 2 years for the next 10 years. And the success measure for this is the number of trips. So your objective may also have more than one success measure. You may want to break it down by demographics, and that's okay as well. But you want to have some way of measuring, are we making a difference with this objective as we're implementing our strategies? Strategies are the place that folks really like to get to, and we'll help you sort out the ideas you share with us later on today and in the next session of, are these strategies or are these objectives? Let us worry about that. Eliza and I will be synthesizing that information out. But when we start melding this into your plan, strategies are specific ways to meet each of the objectives. So these are how we're going to implement an objective. So say your change is, we want to conduct 10 more educational events in the coming year per year. So how are we going to do that? The strategies are going to be the different steps you need to take in order to implement that objective. So characteristics of strategies are, they begin with words such as identify, advocate for, support, develop, train, educate. We want to make sure that we're looking at some policy, systems, and environment approaches, if it's appropriate, to create more longer term change. They're usually much more sustainable, and there may be a few areas where that's appropriate organizationally, especially where we've got some things in there about documenting policies and protocols. So an example of a strategy for our travel example is research locations for travel, develop a budget, establish a savings plan, identify a timeline. Each of your objectives is going to eventually have 4 to 6 strategies, ideally. Some end up with more, but they usually end up being very similar. Here's the overall boil down of our example. So our priority area was traveling. Our goal was to see more of the country and experience other cultures. Again, very broad, very idealistic. Our objective is our family is going to take a trip in the US every 2 years for the next 10 years. Our success measure is the number of trips. Our strategies are researching our locations, developing a budget, establishing a savings plan, identifying a timeline. So this shows how we build from the broad priority area down to the specificity of strategies for each of the objectives under our goals. So just wanted to share that with you so you understand the definitions of the terminology that we'll be using as we go through planning. And Eliza, am I popping it back over to you right about here? Or do you want me to take it home?
You can take it home.
All right. So what we're going to be doing with you today, session one, as Eliza mentioned when she was sharing the agenda, we're going to be developing goal statements, draft goal statements, and we're going to be doing a whole lot of brainstorming for the priority area. And again, you get to leave it up to Eliza and I to help sort that into objectives and strategies for your review. So we'll be synthesizing the notes from today. We'll be drafting objectives and strategies for your review and consideration and discussion for session two. So then we'll take a look at those. We'll refine them. We're going to brainstorm some additional strategies as well as partners and resources, and all of that will go into building the draft of your strategic plan, which you'll then have an opportunity to review and comment on in its entirety. So that's the process between strategic discussion one and strategic discussion two. So you're giving us the fuel, we're taking that and melding that into something and then giving it back to you for your review and feedback. So by the end of today, we'll have a draft goal statement, and we're going to have a whole list of brainstormed ideas underneath each of the priority areas that are going to support that goal. And then we will craft those into objectives and strategies before we come back to you again. And we want to save next steps for the end, Eliza, and we'll pop on over to the notes document and get the facilitation started.
That sounds good. All right. I will steal sharing.
Oh, do you want to do that? I think you're facilitating the first one, so I can take notes while you facilitate, and then I
Oh,
can
yeah, actually,
swap
yeah.
it back.
Sure. Great. So we'll start with the first priority. So this is around engagement and communication. So as a reminder, this was really thinking about kind of external communication. So how folks know about the services of Greater Boroughs, as well as how you communicate with your boards of health, with your individual towns. So thinking about those different forms of kind of external communication and engagement with the community. So what we're going to do to start is we're going to do a brainstorm around the goal statement. So we won't ask you to provide an already perfectly developed goal statement or anything like that, but we'll just start by thinking about, are there particular concepts or ideas that you'd like to include in a goal statement around engagement and communication? So thinking about if there's particular ideas you'd like to see in that goal statement. Again, thinking that, as Donna explained, that this is a vision statement. This is what we want to see in this area. So if we do what we want to do around engagement and communication, what will that look like for Greater Boroughs? So I'd like to give folks a couple minutes to do some individual brainstorming. So if you have something to write on, you can always jot down a couple notes or just give it some thought. Again, we'll start with just some general, here's some concepts, ideas that we'd like to see in a goal statement. So take a couple minutes to do that, and then we'll discuss as a larger group. All right. Who would like to start us off? What were some of the things that came to mind as you were thinking about this priority area?
I can go.
Great, thanks, Taylor.
One of the things that I was thinking of is like maybe like a promotional toolkit.
Mm. Something that like each town could use to.
Right, exactly.
Mhm. Great.
Outreach at community events.
Mm-hmm.
Yard signs, putting up flyers in the community centers, libraries, council of aging, laundromats.
Nice. So thinking about kind of where the spaces that people are, how can we get our message out there?
I would say big picture, just brand recognition.
Brand
Yeah, mine was
recognition.
more along big picture, like just in general, like a rollout plan, like how we would disseminate data or like information. Sorry.
Mhm. Yeah, I think this is a great start. We have some things that may end up being more, I would say, like the strategy, like outreach at community events might be more of a strategy, but I think it's helpful to get ideas down of what do we want within this priority area, and that can help get us to a goal statement. What else?
I think maybe within that, just an understanding of who we are, what our funding source is, and what we do.
Mm-hmm. And you say understanding, is that the community understands that, your partners, all of the above?
I think all of the above.
All the above.
I think of being an information resource for community members as a group, kind of helping direct people, but also having kind of in that vein of like a promotional toolkit, like health information.
Mm-hmm. So if someone in the community was looking for health information or resources, they could reach out to Greater Boroughs. And even if it's not, you're redirecting them, they can, it's kind of, you're providing that hub. Anything else that you were thinking about that you don't see reflected here? We have the promotional toolkit, thinking about rolling out and disseminating information, outreach at community events, yard signs, and that kind of getting flyers and information out in different locations in the community, brand recognition, understanding by community and partners of who we are, our funding sources, and what we do, being an information resource for the community, being able to direct people.
I think one thing that we already do is a bi-weekly newsletter, but maybe we already do that, but maybe specifically target some of those internal people that we want it to go out to.
Mm-hmm. Like the boards of health.
Like in municipal, yeah.
Mm-hmm. Yeah, that's a good point. And that was something that's reflected here in those bullet points under this priority, is that engagement with town partners, town leadership, and community members. So that I don't know if folks have other ideas related to that, kind of engaging the boards of health, engaging town leadership.
Taylor, do you upload the newsletter on your webpage?
I don't, but I know Jen does.
Yeah, we don't either. That's why I asked.
I would say part of this is just improving our website, and I know
Yeah.
the website is kind of hosted within Northborough. So we are actually getting like the newest edition, newer edition of Civic Plus coming out soon. So hopefully that should help as well.
Right. Sounds like also maybe some coordination around, hey, we've been posting this to our website, and maybe other towns would want to do the same, like that kind of sharing as well.
Or just like creating a streamlined SOP for what we are
Mhm,
expected to with certain things.
mhm.
Yeah, I believe that would be helpful as well.
Mhm.
And then Michaela already does a great job creating the annual report that we've done. This is our second year doing it, but maybe, you know, one of the strategies is present the annual report to our boards of health. That might be a way to both like show them the annual report, but also engage them in our work.
I also think the select
I love
board
that
would be
idea.
helpful.
Sorry, go ahead, Jennifer.
I also think presenting it for the select board, because they're the ones who have to agree to continue as a partnership and to know what we're doing would be helpful.
Yeah, you have that great annual report. So, yeah, sharing it with the boards of health, select boards. I think this is a really great starting brainstorm for this priority area. Um, I would love for us to think about how we might formulate a goal statement. And I think about this going up maybe a level kind of more big picture than what we have in the brainstorm. So maybe think about if you were to do these different activities, what would the outcome be? How would you describe what would be going on for Greater Boroughs or going on in the community? Would it be, you know, people know? I'm thinking about that bullet point around directing people understand who we are, our funding resources, and what we do. Is that maybe the outcome that you want? But think about how, if you were to do this, what would that outcome look like? And I think that'll help us get to our goal statement.
I kind of had two, they were like two-step process. So I had by the end of 2027, we will create a promotional toolkit and rollout plan for awareness of Greater Boroughs. And then the second one was like we could, and I didn't really have a specific date. I think the group could decide, but by the end of whatever day, we will see awareness of Greater Boroughs through survey data across the 4 towns. That X, when we could decide a percentage of people have awareness of what we do.
That's great. So it's by the end of 2027, we will create a promotional toolkit. Was it and rollout plan
Yeah.
for greater awareness of Greater Boroughs? And then by the date decided on, we'll see awareness of Greater Boroughs through survey data across the 4 towns. So these are both really great examples of objectives because they have the date, I appreciate that, trying to make that measurable with the percent. So that's a really great start for objectives. But I think maybe even then we go one level higher to get to our goal statement of where do we want to get to in terms of what would it look like in the community if we achieve those objectives.
Yeah, think at the very, very abstract level in terms of, think of our example was, you know, we'll travel more of our country and learn more about culture. So it's very general, very broad. So when you think about engagement and communication as an entity, what is it you want people as they look at GBPH? What do you want people to think about in terms of engagement and communication? Do you want them to think, oh, GBPH, they're a trusted source of information. They are great about engaging with all sectors of our community. They are reliable. So what concepts, what adjectives do you want to put in here about, you know, what you do, and how that might be perceived by the community? And then our objectives, as Taylor just shared, those are the things we're going to try to change or do more of to get closer to that goal statement that we're trying to create.
I like timely, reliable, trusted resource, like you said, Donna.
Transparent.
Transparent.
Consistency.
Consistency. So you could think about a goal statement that is Greater Boroughs is a reliable, trusted resource, or a transparent, trusted resource for reliable and timely health information. That's an example of a goal statement. I will say that I think that's missing maybe some of like the branding piece of it, and the connection with your towns and your boards of health. But I think that's a good, starting place maybe for a goal.
I missed the end of that, Eliza. Greater Boroughs is the transparent, trusted
resource for reliable and timely health information.
I would love something in there about increased awareness. I think ultimately that is our goal for, all of the above of the people I had mentioned. But I do think if we had surveyed people right now, like Taylor said, that percentage would be fairly low.
So awareness of Greater Boroughs.
Correct.
Yeah. So maybe we could have something about Greater Boroughs is recognized as a transparent, trusted resource for reliable and timely health information. So that's kind of, in order to be recognized by the community as such, that means that people have to be aware of Greater Boroughs.
There's lots of different ways you could say that. And then your objectives would be, how are we going to increase that awareness of Greater Boroughs and the work that you all do?
I also think like at an organization level, wanting people to know like the 3 primary objectives in some way of like who we are, what we do, and how they can partner with us, whether that be community or other partners.
I like that. Who we are, what we do, how they could partner with us.
I like that a lot, actually.
Yeah. So you could have, I'm trying to think of if you could try and formulate that into a goal statement. So you could have something like members of the Greater Boroughs community know who we are, what we do, and how they can partner with us. So what do people think? We have the option number 1, we have option number 3. Do you have a preference either way, or what are you thinking as you look at those two?
I think based off of the actual priority underneath, like number 3 would maybe be the better option for this, just because it's about awareness, but there's also the trust piece. So
yeah, and we could maybe also try and weave in some of those adjectives.
We could almost tap this at the end. So we could say members of the Greater Boroughs community know who we are, what we do, and how they can partner with us for reliable and timely health information. So that kind of speaks a little bit to what you do, or a way in which you do it, reliable, or as a...
Probably be reliable and timely public health information.
And we can swap out the, reliable and timely for trusted and...
I also wonder if we keep it more broad as like a reliable and trusted public health resource, because we do other
like
things
that.
outside of just
Yeah.
information.
So change it to how they can partner with us as a reliable and trusted public health resource. Yeah, I like that tweak.
That's much better.
We have members of the Greater Boroughs community know who we are, what we do, and how they can partner with us as a reliable and trusted public health resource.
Yeah, I like that.
I like it too.
Is it not working for, or tweaks that you'd like to make? Okay, does that mean folks are good with this being our
How
draft
about
goal? Jennifer?
how about members of the community recognize us as recognize us as who we are, what we do. No, know us. I'm trying to get the word recognize out of instead of remember the community know who we are, what we do.
You're saying you'd like recognize in there instead of like no?
Right.
I think
Recognize
that's
us as
What about members of the community recognize who we are, what we do, and how they
yeah,
can
I
partner
think
with
that
us?
sounds fine.
Yeah.
that's
Yeah.
better.
Any other tweaks? We'll also have a chance the next time we meet, we'll kind of look at everything with fresh eyes. So we can always, make tweaks then. But if people feel comfortable having this as your draft goal statement.
I'm good with that one. Last one.
All right. There it is. We have our first draft goal statement. Very nice. All right. Well, we still have about 20 more minutes that we could use to look at this priority area. And I think you already did a good amount of brainstorming in terms of strategies and objectives. But I think this opportunity to, especially maybe now that we have our goal statement, if there's any additional objectives, strategies, or just ideas that you'd want to have in this priority. And I know we don't have a chat function. Would it be, we have a Padlet where people can go online and add your thoughts there. Would that be something we're able to share via email, or prefer not to, just with the open meeting?
Yeah, we can't because the open meeting.
Okay, no problem. Just wanted to double check. Okay. So yeah, if we want to look, we can look at the list that we've already brainstormed here. So around the promotional toolkit, outreach, yard signs, thinking about brand recognition, being an information resource. I think that came up in a couple ways of being a hub that people know who you are, they trust you, they come to you. Coordination of communication efforts, using the annual report. Is there anything else that's not here that you'd want to see in this priority areas? Maybe actions you're going to take, activities you're going to be doing?
Sharing all public information from Greater Boroughs evenly throughout all the towns. That way it reaches every town equally.
Hmm. Are there ways you could see, or what would that look like? Would it mean more coordination between the towns? Would it mean those SOPs? What would that look like?
Well, I think every town has their own set of rules and what they can share and what they can't share. So
Right.
that could be fertile.
Hmm.
We're not really limited on what we can share here.
You're all kind of
Sure about
working with,
other towns.
right, like a different set of regulations in each town. But I could see that maybe being part of the SOPs is maybe it's not as specific as like everyone will post this thing on their website, but maybe it's, in the capacity that each town will share, the newsletter in some way or something like that.
I also think one thing is social media. I feel like it probably would be covered in a promotional toolkit or an SOP, but kind of similar to Jen's point of knowing how to use that, either individual town social media or like we have our own GBPH Instagram, which doesn't have a lot of followers. So maybe increasing that would be nice.
I mean, I'd like that you do have Instagram. We're not allowed to have Instagram, but we utilize Facebook a lot.
Yeah, I can see what you mean by each town is like a little different.
And I think maybe like optimizing that, like we don't have a Facebook, and I know Facebook reaches a different group and honestly a lot of times a larger group. So like optimizing what towns already have and can use, and then filling in with GBPH's own social media where necessary, kind of thing.
Yeah. There are other strategies you could envision for engaging your boards of health and town leadership. So you have kind of sharing the annual report. There are other things you'd like to be doing?
I think that's why if we did presentations in front of our boards and the select boards, that's our leadership. So I think that's covered. Maybe having a table at town meeting in each town.
So that way, when people are coming to town meeting to share their input on something, they can
And I'll-
also learn more about.
And also, I know Westro's Farmers Market is huge, so maybe having a town table at
Oh yeah.
Farmers Market. I'm not sure if each town has one, but that's something that we utilize here.
Yeah, it's
We also
exciting.
have a TV
farmers markets
station in
Oh,
town
nice.
called Westboro TV, and they interview. So if someone, Michaela, wanted to go on an interview and answer the questions, or they will always prepare you ahead of time, but that would get out to, and I know other towns do actually watch that. I'm not sure what other towns have for TV or things like that.
Yeah, in Northborough, we have the Northborough Media Connection. And we're actually working with them right now to make a Greater Boroughs Partnership for Health promo video. So they interviewed like Penny, Vinny, and myself. So definitely sharing that or doing interviews. Jen, happy to do that in the future.
It's like, thanks, Jen.
I had practice from the promo video, so.
Anything else?
How about the building trust with the community? I mean, there's that hopeful byproduct that will help as you share more information and people realize that it's good and it's accurate. But are there any intentional steps that you can think of that you want to take specifically targeted with that? At least not as a primary purpose, but at least a parallel purpose.
Yeah, just in parallel, like if we're putting out any information, I think it's important to have a reference attached where people can easily access the reference, not just like putting where we got it, but having a link attached to it so that people are able to see where we got our resources from. I'd say obviously you don't have to do that every time, but if there's something like that's seen as controversial, we should be doing that.
That makes sense. Yeah, you can kind of flag things that.
I also think creating, unfortunately, it costs money, but creating more things in different languages.
Yeah, that's a great point. Different languages. We often talk about like using simple language as well. or I think there's a better term for than simple language, but plain language maybe.
Plain, yeah.
Plain language. Yeah.
I've been giving updates regularly at my board meetings about Greater Boroughs
Mhm.
and what, the latest adventure, if you will, is, or what's planned, or what's coming up. So that may help.
Mhm.
You can tell me if I'm wrong, Michaela. At our last meeting, did we vote to look into hiring someone for education? A health communications person?
It was kind of proposed as a potential option for FY27. I don't think we've like officially.
We didn't officially. Okay. I mean,
Yeah.
I would say like we could say like continue research on potentially hiring someone to do all of this work for us.
Mhm.
That would be
Yes,
helpful.
yeah, that would be huge. Yeah, sometimes we'll say like explore as a way to
Yeah,
kind of give
that's
you
what I was looking for. Yeah.
give you a bit of an out. Yeah, so explore hiring someone who's focused on the health education and engagement. That's great.
I know it's come up before too of like health fairs or other kind of community events
Mhm.
that we can either attend in that tabling or host as Greater Boroughs.
Right. So I don't know if sometimes if it's tricky if you're doing like, let's say Westboro has a health fair. Do you attend as the Westboro Health Department? Do you attend as Greater Boroughs, or do you both have information for both? Maybe it gets back to the SOPs.
Yeah.
Right. As you look at what we have brainstormed here, do you feel like if you did these things, like you'd make the change in this area that you'd want to make, that at the end of a few years of doing this work, that you feel like people would know more about Greater Boroughs, who you are, what you do?
Yes.
Yeah.
Especially if we hire someone.
Yeah. When do you find out about like the FY27 or the next funding cycle? Do you know for Greater Boroughs?
We are still waiting. We're
Mm.
supposed to get the FY27 work plan, I think, sometime in the next couple of weeks, and that goes along with the budget. It should look relatively similar to this in terms of like structure of the work plan and budget should look similar. And then we have our board meeting June 11th to hopefully kind of look at the scenarios and finalize FY27.
Gotcha. All right. I think this priority area is really good shape. And what Donna and I will do before the next meeting is kind of take what's here and just kind of do a little zhuzhing so that we have a couple, maybe 2 to 4 objectives with those strategies underneath to share with you all. And you'll have another chance to kind of look at it, make edits to the strategies and objectives, have some time between now and then to think, actually, I think we should do X thing instead, and we can make that adjustment as well. But I think this is a really great starting point for this priority area. Any last thoughts on this before we can go to maybe you'll have a little more time for voting before we go to break. All right, I'll pass it to you, Michaela. Our first priority area is done.
Yay, that's exciting. So I'm gonna share my screen. Hopefully this works. And just go through those couple of quick voting items. Okay, can everyone see that? Okay. So we sent this out beforehand. There were a couple last minute additions that I'll talk about, but first want to talk about the tick card printing. So last time we did already approve the funds to translate and print the cards. And we agreed to print 800, but then I realized we didn't necessarily specify like how many of each language we want to print. So we have it translated in English, Arabic, Haitian Creole, Portuguese, and Spanish. So wanted to see how many in each language people want to print, and if 800 is still the number we want to print before sending those off.
I would say 400 English and then 100 for the rest.
Okay.
So 100 for each town in English.
Mm-hmm.
Okay, I'm fine with that.
That sounds good.
Okay. We'll print that, and then depending on how quick the turnaround is, if people find that they want more, we can print more too. Because I know it's a busy tick season. But we'll start with that, and then we can always print more too in July if we need to.
Do we need to spend more money down?
We do have funds to spend, so if people want to print more than 800, we can do that. I haven't sent this off yet, so if we feel like we want to do like 200 a town, they are just like little business cards.
Yeah, that's what I would say. Bump it up
Okay.
to 200.
200, and then still that would be so
2, 4,
yeah. What's the math
8,
on that? So basically double
9,
it.
10, 11. That's $1,200. I mean, 1,200 cards.
Yes. Okay. So we'll do that and kind of the same split of majority English and then the same of Arabic, Haitian, Creole, or Haitian Creole, Portuguese, and Spanish. Yeah.
Do you want to vote on that?
If you want to.
I
Would
move.
you want to do all of the printing stuff together? I don't know, it doesn't matter. Just so we don't have to do every one of them.
Yeah, we can do it all together if we want to just move on to the brochures real quick. So then the other printing item are brochures, because they have like our staff on them. They updated this year, so wanted to see if people want to reprint the updated versions. And we also have these translated. I think we got them translated after we printed them last year. So I don't think we have any printed in the translated languages. So last year we printed 600 brochures, which was this cost of $318. So want to gauge if people want to print them again, and if we want to print them, also print them in the other translated languages as well.
I think we should definitely update them since there's new staff.
Yeah.
Okay.
But I
I
don't
agree.
think we need more than 600.
Okay.
Agreed.
That was okay. So 600 feels like a good number.
Yeah.
Okay. And then do we want them printed in the translated languages as well?
I think we should do that.
Okay. And then similar distribution to the tick
Yeah.
cards. Okay, cool.
Do you want a motion on those two?
That would be great.
I move to print 1,200 of the tick card in multiple languages and also updating the Greater Boroughs Partnership for Health brochures.
Second and vote aye, Taylor from Southborough.
Jen Sullivan, Westboro.
Emery, Boylston.
Isabella's not here, so.
Okay, I think it's just, that's good. Okay, so I think that passed. The other item is the air quality meter. We brought this up in a previous meeting as kind of a bigger ticket item to spend down some funds. I reached out to the training hub to see if they have any recommendations on air quality meters, and they kind of seemed that like typically groups will borrow an air quality meter from like a fire department, or I think the training hub does have one. So wanted to gauge if people felt like this would be something useful to have on hand as a group, or what the primary function would be. Like if this comes up a lot as something we wish we had, or is something we can maybe coordinate with other organizations to obtain if we need it.
I mean, we get calls about orders all the time. So
You do? Okay.
whether we want to, I think we should buy one and use it shared as a group probably. Unless depending on also how much money you have to spend down.
We do have funds to include it. I kind of threw, it seems like the range is usually a couple hundred to $1,000. So my next question would be, what type of meters are you looking for? In terms of kind of what you're hoping to measure with them.
What a moisture meter.
Moisture meter?
I don't know. I know that when the fire department goes out, I mean, we don't want what exactly they have, because they can go out like reading the recognizing gas odors or things like that. But I know that if there's an oil spill, you go in and you test the air quality. So I just, something other than, I would say, let's ask our fire department, see what they have, and find something that's not as equal.
Okay. Sounds good. What about other towns too? Are there scenarios where you need a specific type of either air quality or moisture meter that we can look into?
I'm fine with moisture meter as well, or both.
Okay.
Yeah, I know we don't have one. I know Boylston doesn't have one.
Okay. Okay, so we don't have a specific one, so there's no vote necessarily. I just kind of wanted to gauge what the interest would be. So I can look into coordinating with the fire departments and with you all to find either an air quality meter or moisture meter, and then we can vote on that in the next meeting. So the final piece is contact tracing spending. So we asked and got approval for these 4 items to spend down some of the contact tracing funds that we still have. So I'll talk about the first 2. I don't think Isabella's hopped back on, so I can talk about the sunscreen too. And then I'll pass the N95 fit tester to Taylor to talk about a little bit. But for the first 2, we got approved to purchase individual hand sanitizers and first aid kits that are branded. So we were thinking of purchasing roughly 500 units of each of these. And for the hand sanitizer, that would be $845. And for the first aid kits, it would be $27.25. So want to gauge if 500 feels like an appropriate amount, if there's any other kind of recommendations or thoughts on spending the contact tracing funds for these items.
I feel like the first aid kits would go quickly.
So fast.
Yeah, so I feel like more than 500 would be beneficial.
Okay, yeah. we
Like
definitely-
200 per town. If we're gonna do it and it got approved, let's do it.
Yep.
Okay, awesome. That sounds good to me. So we can do that, the first aid kits. What about the hand sanitizer? Same sentiment of,
Yeah,
Yep.
I mean, for sure.
cool. Okay, we can do that. So I'll get those ordered as soon as we can. And then for sunscreen, we did get approved for the sunscreen refills. Last year we ordered 24 refills, which is about 1,900. I think our main question again is how many refills we need for each town. Like how many dispensers each town has, so we can order those.
I would have to check to see and let you know.
Michaela, is this from Impact Melanoma?
Yes, that's who we
You know-
ordered through last year.
Okay, well, Boylston has 3. And right now we have ours, because we actually purchased our own refills last year. So at least for this season, we're okay.
Okay,
Unless we go through an abnormal amount, then I should be okay until Labor Day.
okay. And we only have the contact tracing until the end of June.
I would still
So
get them.
do what? Sorry.
I would still get them.
Yeah.
Oh, okay, then I would take 3 for Boylston, as long as the date is past next year, next summer.
Okay.
Yeah, and I would just interject here, sorry. I know this isn't part of our agenda, but watch out for the expiration dates on those. So if you ordered some last year, double check those and make sure that they're not expired before this year, because sunscreen doesn't last as long as we think it does in terms of its effectiveness. I won't try another word.
Yes, but, well, mine's good until October of this year, that I ordered it last year, so yes. Oh, believe me, I'm very keen on expiration dates.
Yeah. I just had to clear out a bunch of old expired sunscreen out of my closet. So okay, so that sounds good. Jen, do you know how many you have, or do you need to check?
I will know
I can
momentarily.
probably pull it up, but off the top of my head, I think we have 9.
Fine. Okay, that's fine. I can follow up afterwards to get actual counts. But it sounds like from this, everybody's interested and would like the refills for their dispensers, so we can do that. And then last item is the N95 fit testing and N95 masks. Taylor, did you want to talk about this one?
Sure. Northborough, Southborough worked with the school district. This is just kind of behind the scenes information, but worked with the school district to develop an SOP for measles. And part of that, we identified that the school nurses, at least in Northborough and Southborough, do not get annually fit tested. And do not also carry N95s that they don't fit them properly. So in conjunction with our nursing staff and exposure to the things that we come in contact with patients like measles, TB, etc. There's also not a good place for nursing to get fit tested currently, generally across the board for public health. So our proposal, as far as like our regional nursing staff, was to purchase a N95 fit tester, which doesn't expire. The only thing that expires is the saccharine, which is like the sour tasting smell that you test with yearly, and that's like a small purchase. And then boxes of N95s to fit test any nurse in any of the 4 towns within our offices or the school districts who want to be fit tested, and then also have extra masks for them to store in case they have essentially a measles case pop up that they would need that protection. So we are proposing to purchase the tester, and then 4 boxes of regular size N95 masks and 4 boxes of small N95 masks to be able to do testing and then have some extra for storage. Don't want to go crazy with the purchase of boxes because again, those do have like a shelf life. So I would just hate for them to be sitting there like the millions and millions of masks that we have from COVID that we just keep throwing away by the box. So just purchasing a small amount and going from there.
I love that idea. I know our school nurses also do not have N95s or are fit tested. So
Yeah, so happy to coordinate that once we purchase and go in and do the fit testing.
yeah, thank you. I love that idea.
Yeah, I agree with that as well, because I know the nurse leader in Boylston, Berlin Boylston, is fit tested, but I don't believe all the other nurses are.
Awesome. Okay, so we can get those. Do we want to vote just to approve the contact tracing, or do we want to go item by item?
I vote that we approve the contact tracing spending of 200, or we could say total, so 800 hand sanitizers, 800 first aid kits, the sunscreen refills, and N95s with fit tester.
A second, Jen from Westboro.
I'll vote aye, Taylor from Southborough.
Aye, Amory Boylston.
Okay, awesome. That is all I have. So I will turn it back over to you all, and I think we have a break.
Yes, we do have a break, and I wanted to see what people prefer. If you'd want, we could have a break until 1:25, or we could come back at 1:20 and then potentially get out a little early. Do folks have a preference? Do you want a little bit more break time now?
Oh, 120 works for me.
Your 120 is fine.
1:20? All right, we will be back to tackle priority area 2 at 1:20.
Thanks.
All right, we'll give folks a extra minute to come on back. We get ready to start talking about funding and sustainability. All right, so priority area 2 is funding and sustainability. So some of the topics that came up under that during the key findings were planning for sustainability, utilizing available funding within parameters, because there's always rules to follow, understanding approval processes and parameters, and pursuing additional grant funding and fiscal tools. And as we just saw prior to the break, figure out ways to usefully and creatively use up funding before it expires. Always important. Not often that you have more than you wish you wished for, and you have to figure out how to use it up. But so let's just give folks a minute and a half or so to spend some time just thinking on your own, jotting down on a piece of paper. What are some concepts, some words? You've got a better idea now that we've gone through priority 1 of what we're looking for in a goal statement. We'll definitely be looking for all the juicy objective and strategy ideas as we move on to the next brainstorming exercise. But for this one right now, what are some of those broader concepts, ideas, phrases, terms that you'd like to see us include in a goal statement around the Greater Boroughs funding and sustainability priority area? So we'll give folks about a minute and a half to look at that, and then we'll come on back together. Okay, who wants to go first? What are some concepts, ideas, phrases that you'd like to see included in a goal statement around funding and sustainability? Nobody wants to be the first?
I really struggled with this one because I feel like we don't have a clear plan. So maybe something with the word explore in it. I just don't really know where to go from there.
Well, explore is definitely a word we can use for our objectives, but when you think about Greater
Yeah.
Boroughs as an entity, what would you like, if somebody from the outside was looking in and said, was thinking about how you utilize funding, how you obtain funding, how you plan for the sustainability of the work that you do, what would you like folks to say about it? That's another way of looking at it. So what's that state that you'd like to reach in terms of funding sustainability so that you feel good about what you're doing?
I think it
and
would
where
be
you're going?
nice, like, I'm just kind of looking at each bullet point, like, individually right now, but maybe off, like, having some kind of direction as far as, like, learning, like, grant writing or something like that.
I thought of that as well.
Yeah, that would be very helpful.
I know that my town manager was concerned with how it was being utilized, as in spread amongst the towns. So I'm gonna just put it out there. Somehow creating maybe a tiered cost sharing formula based on population, service demand, or inspection volume.
Yeah, that equity that comes up in the next priority area as well, I believe, in terms of the equitable distribution of resources also comes up under programming and structure. But as you were just looking at before the break, is it 200 per town or is it per town based on population of town? What else? What are
I
some
think
other concepts?
another thing that we talked a lot about at our last meeting is having some type of plan if we lose our funding. So maybe working to create, a funding source. Yeah.
I think like in that vein, like diversification of funding outside of
Mhm.
just PHE.
Mm-hmm.
Yep, so funding is absolutely a really big part of it. And sustainability is, do we have enough money to continue, but it's also, do we have the staffing to provide the services and the programming that we want in terms of how do you look at that?
We talked about in the beginning how you track things. So maybe track the outcomes to justify future funding.
Yep, that's an important part of it in your grant writing is what's your track record look like? It's not just what do you plan to do with this, but what have you done with money you've gotten in the past to show that you're a good steward of it? What else?
I'm not sure. I mean, employees can't engage into it, but board members certainly could, like advocacy for funding. The other thing that we could think about is possible regionalization. Maybe looking at some type of study to see, for staffing, for sustainability, like using an outside company to help us guide us just like for next steps. I'm not sure. Getting a grant for it.
Yeah, I feel like, oh, sorry.
No, go ahead.
I feel like a lot of it is optimizing the funding while we have it, while also looking forward to make sure that we can sustain consistent services while also being flexible and adding services as need changes over time, which is really hard to do when you're constantly applying for grants and they all have different requirements. But yeah, like optimizing the funding while we have it and thinking ahead to what we can do to fill the gaps when they come up.
That could be a great start for a goal statement. Any other thoughts to add to that before we take a shot at drafting a goal statement? What are some terms you'd like to see in there in terms of, like, earlier on, we brainstormed a whole bunch of things that were more strategy and objective like, and then we came up with some terms around timely and reliable and trustworthy and recognizable. So what are some terms you'd like to hear people use when they're talking about funding and sustainability in terms of Greater Boroughs? We've got consistent in there, optimized funding, flexibility, diversification,
Efficiency.
efficiency. Yeah, that's a good one.
Mutual aid.
Longevity.
I think we talked about it at the beginning, but equitable.
I think even though it's specifically mentioned under priority 3, I think equity is important across all 3 priority areas.
Optimization.
And all of this is in service to, how did we end it on the first one? Public health services, public health. Oops, I won't make you scroll back. I'll pull it back on mine. Trusted public health resource was the phrase that we used early on. So providing public health resources. Does anybody want to take a shot at stringing a draft goal statement together, or would you like us to work a little bit of magic with these?
Can you scroll back up to the
Great.
first one just to refresh ourselves?
Yeah, the first one was members of the community recognize who we are, what we do, and how they can partner with us as a reliable and trusted public health resource.
Thanks.
So that was our goal for 1.
Greater Boroughs Partnership for Health. Strives to provide
Health and wellness.
equitable and stable public health resources. And then we could tag on something about like longevity, but not use maybe the word longevity, but for or through. I don't want to say like, I don't think stable funding is the right word, but something similar to that, because we can't necessarily have that as that's our ultimate goal, but.
Yep.
I know what you mean.
How about if we weave that in at the beginning or in the middle, Taylor, instead of trying to tack it on at the end? How do we say something like, and you just copy that whole thing, Eliza, and add this if you want, a Greater Boroughs Partnership for Health utilizes, or some other word, diverse funding to provide equitable and stable public health resources.
Love that.
Diverse funding to, or what's the other one? Longevity, efficiency, equitable optimization. Greater Boroughs Public Health. I hate the word utilize, but that's what comes to mind to begin with. Greater Boroughs and
You could say equitable and because you can't say stable twice like that.
oh yes, yeah.
What about like maintains or continuously explores instead of utilizes?
You could say maintains, and I think you could just say maintains and continues to explore different diverse, or you could say sorry, delete different, but you could say to explore diverse funding sources to provide equitable and stable public health resources, information.
Or how about if we say
Programs.
to provide ongoing equitable public health resources? Because I think the stable is implied by
The
you're
ongoing
providing them
piece.
Yeah, I
their
like that better.
equitable.
Mhm.
Maintains and continues to explore diverse funding sources to provide ongoing equitable public health resources. What's missing, or what needs to be swapped out, or does that look good? Getting the hang of it after priority one.
I kind of feel like I don't love how it says maintains and continues. Like maybe it says Greater Boroughs Partnership for Health continues to explore diverse funding sources while maintaining.
Or to maintain ongoing. Although the while like assumes you're doing both as opposed to you're doing one only to do the other. Greater Boroughs Partnership continues to explore diverse funding sources.
How about continue instead of maintain?
Yeah, I'd think maintain is where
We
I'm.
got continue in there twice, but
Oh,
Greater Boroughs Partnership for Health.
which brings us back to utilizes or something else for the I like the explore because it's not confirming that you're absolutely going to get a lot of diverse funding sources. You just say Greater Borough Partnership Health Partnership explores diverse funding sources to or employs diverse funding sources to maintain.
explore diverse funding sources to offer.
Offer or sustain
Oh,
ongoing.
I like
Yeah,
sustain.
that's better.
Greater Boroughs Partnership for Health continues to explore diverse funding sources to sustain ongoing equitable public health resources. So do we want to keep the continues to explore or just change it to explores?
I think the continues piece is important because
Mm-hmm.
You're
we
never going to stop. Yeah.
Yeah,
It shows that we were and will continue. Like
I agree.
Yeah.
I think it has to be there.
Yeah, you're never going to arrive there. You're going to always be on the journey. Greater
Yeah.
Boroughs Partnership for Health continues to explore diverse funding sources to sustain ongoing equitable public health resources.
I like that, just like that.
Yep.
Folks good with that?
Yeah, good job, T.
Nice, nice, nice. All right. Draft goal statement number 2, down and ready to roll.
Look at us move.
Look at us move. So now let's talk about what do we need to do? What changes do we need to make to get us closer to that goal? So we already talked a little bit up above around, I know the split drives us crazy here. So we've got some grant writing, so exploring, we got directions for learning grant writing, resource distribution. So we've already got a few brainstorm ones up there that we'll use. What else do we want to add to that? What other things do we need to do to get us closer to continuing to explore diverse funding sources?
Partnerships.
I think we just need to have a plan, and right now we don't have that. Like looking at just like a bigger picture.
Yep. And plan in terms of what, Taylor? What do you want to include in that? What components need to be part of that plan? You scooch up just a little bit
Like,
higher,
I know
Eliza,
that
so we
you
can
might
see the
not-
goal. There we go.
This may not be helpful, but just like a plan for sustainability in general, which I think is like one of the things on there, but I think having that is like the most important piece.
Yep. And what would be in there? That would be what if we lose a staff member? What if we
Well, yeah, I think like if we lose a staff member, how quickly can we get someone? If we lose funding, or if we have a position posted for a year and nobody's interested, how do we pivot? Like I think all of those challenges. If, you know, we have an item that we really want to purchase and it gets denied by the state, like what is the succession plan there? So I think, you know, right now we can figure those things out, but having a solid plan, I think, especially in relation to employees, is the most important piece, because that's the part that hurts us the most.
Yeah. So what if Michaela won the Powerball tomorrow and is on an island somewhere drinking fruity drinks? Have you got an updated job description, and how quickly can you post that, and how can you fill it in the in-between time, and how can you get us
But
to
then
share?
also
Get her
too,
to
like,
share those.
where are you posting the position? Like, is the salary equitable across PHE grants? Like, how are we making this position desirable?
Yep. Yep. I mean, sustainability planning is all about identifying the steps you would take if it happens versus waiting for it, whatever it is, to happen and then scrambling when you're in
Right.
an emergency situation to figure it out. So,
And I think we
even
have done a good job of that for the most part, but where like we don't have anything formalized.
Sounds like we need an SOP.
yeah,
And
it
I'm
doesn't
not
have to
saying
be a
that
whole
you need an
separate
SOP
plan.
for anything, like as a nurse and I'm like in emergency management too, like that's like SOP, 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 but I definitely don't know that we need an SOP, just more of like in some type of thing that says at least like our goal is to post a position that someone leaves within X amount of days, you know?
Yep. Yep. And it doesn't have to be, I mean, it can be an SOP, or it can just be, hey, here's a process that we're going to follow if this should happen. So it can
Yeah.
be, you know, standing operating procedure, but it can also just be here's our intent. We'll review it when the time comes, but at least we've thought it through and said, you know, like for your example, here's where we would post it. You know, we need to make sure we're being equitable with pay, which I'm sure is happening now as you consider raises each
Me
year.
too.
But
The other, just going back to that advocacy piece, like advocacy on a state level, but also, I mean, we behind the scenes can be advocating at our like municipal level, to like our select board and, you know, town management for like, if we lose this funding, you know, are you like on board to endorse us to hire potentially 3 shared positions and having the data to back up why we need those positions.
Yep.
So I think that's an important part that we don't have written down there is like having the data at the ready to support why it's so important to have the people that we do stay and what it would look like if those went away.
Yep. The impact that would have. What other changes do we need to make to bring us closer to our goal of continuing to explore diverse funding sources to sustain ongoing equitable public health resources? As we mentioned earlier, there's some things in there about grant writing. We've run into that at HRIA across so many of the smaller organizations. We have the greatest need for money, but we have the fewest resources to take the time to write grant applications to get money. So it's that catch-22. The folks who need it the most have the least amount of resources to pursue it.
I also think like education and awareness of where to find grants and like how you search for them.
Absolutely.
Yep.
Writing them is one thing, but I feel like I don't even know where to find them to begin with.
Yep. And I don't know if the PHE program encourages this at all. Eliza, you'd know more. Do they ever talk about pursuing businesses supporting with fundings and sponsorships or philanthropy or other avenues other than or in addition to grant writing?
Something that came up in the key informant interviews was like using different fiscal tools. And I'm forgetting, there's the one, and I know some of the towns are already doing this, but setting up, forget the name of the type of fund, or rethinking fee schedules and raising fees for inspection services and things like that. So using different kind of tools that you have at your disposal.
Do those fees come back into Greater Boroughs or do those go back into the local
government.
local government?
And they go into the general fund.
Mhm.
Yeah, but I know some organizations will be like, oh, we're going to do tabling and 3 of the towns have fairs coming up. You know, would you as big business that works across all 3 of these communities like to sponsor our table at the fair? And then you can have a sign there that says, you know, today's information table for Greater Boroughs is sponsored by A, B, and C. And have them provide funding that you can then use to purchase swag and get printouts of the things. So there's always, you know, little buckets of things like that if within the program they allow that kind of thing. But there could be an objective we throw in here about explore funding opportunities beyond grant funding. What else? What other ways?
I think we need to get our boards together and discuss whether or not, like Taylor said, I think that's our number one thing that we would have to do is to discuss paying for these employees.
So if
Like
the
our
PHE funding
contingency plan.
suddenly poofed, would the towns agree to share the costs for keeping Greater Boroughs alive?
Mhm.
Yeah, and I think also, you know, we need to be mindful that different boards have different structures too. Like our board's elected and has more authority on those, and some need to report also to their select board. So, like knowing who you have to sell to.
As an intermediate step or as a separate smaller step other than, hey, could you support Greater Boroughs in its entirety if the funding went away? The other sub bullet that was suggested up under here was looking at a formula for sharing potential staff or services between towns. So if Greater Boroughs wanted to add a position that wouldn't be covered under PHE funding, but there was still PHE funding existing to support PHE to support Greater Boroughs as a whole, would the towns be willing to do that? That was one of the suggestions that came up. Is that something you guys would like to include under this priority area, or is that a bit of a reach?
Well, Taylor, out of all the towns, Boylston has me as their hired public health nurse, and then Southborough has you, correct? As their public health nurse / director. So it would be Westboro, Northborough, correct? That would need the nurse?
If we were talking about nursing, but there could be other services that
Right.
that you decide to hire somebody and then figure out how to just share those services across the communities. Yeah, we don't have to decide who it would be or how it would be done. Just do you have the desire to grow in staffing beyond what the PHE funding is allowing for, and would the towns be supportive of that? That's sort of, I think of that as sort of a small step to, hey, if you're willing to share the cost for, +1 staff, if the PHE funding went away, would you mind sharing the funding for the other +3, +4, +5? Kind of a baby step to get them towards thinking about that. What else? We had a lot in here about understanding parameters. So I think somebody already said something around education, on education awareness around how to find grants. I think there could also be some education, or there's not necessarily education, but when you do have grant funding, find a way to, pull out of the pages and pages and pages of information that comes with administering a grant. Pull out of that, hey, we have really clear communication on here's what we can and can't use it for, so you don't find yourselves constantly revisiting that. So how to be clear amongst yourselves what the parameters are in grant funding. That's a really tough line to walk sometimes. How do you folks do that now, and how would you like that to be different in the future?
Maybe we'd have to write a grant, all of us together. Like it can't just, like I could write a grant, and unless they approve it in the grant, then that's how we share it, right? So I don't know how that would work. I guess it depends on the grant. Right? Am I right?
Yeah, I think in terms of parameters, it changes. Like with PHE, there's definitely explicit, like allowable expenses and kind of how things are supposed to be regionalized. Like everything, for the most part, should be, like we've talked about, equitably distributed. So I think like short-term goal just within this current grant is kind of potentially reviewing or having like a quick one pager of what allowable expenses we have so that it's easy for people to reference. And potentially like, not to harp on the SOPs, but I think it's helpful to have points of reference for like how to request things. We have some forms that we use now, but in terms of a group and an advisory board, like what warrants coming to the advisory board and getting approval for, what are more routine expenses. I think kind of clearly outlining some of those spending parameters and priorities.
Yeah, I don't think the opioid abatement funds would work for this because, I mean, for one, Northborough, Southborough has an agreement already. We're not in that agreement. So they're very particular on what they're spending it on, and it's not going to pay for inspectors, or it's all about opioid and education on that. So they may hire an educator regionalized for those two, but we're not, like Boylston and Westboro aren't part of that. So I just don't think the opioid abatement funds would be an option. I think the revolving funds could be an option, but it has to, again, go through town meeting And I know every town's different.
I also, I don't know if this would be the place for it, but almost like a landscape analysis of where we currently have fundings as a region, but also individual towns, and what the process would be if you were to share between towns in a revolving fund, or just like understand what the process would be if you wanted to add funding. I don't know if that makes sense, but
Yeah, no, yeah, I was thinking earlier, it's like, talking with you folks, I would love to have a one pager that tells me how the town how the town process and decision makings work differently between the towns. So you were mentioning earlier, Taylor, some have, or maybe Jen, that was you, that some have elected boards of health, others are volunteers, some have to report to certain folks, some don't. It might be handy to have that similar landscape in there in terms of, and this town has this funding, and this town is part of this partnership, and this town is part of another partnership. But sort of have that handy dandy reference documents to help us understand, oh, this is going to be easy to get through these three communities, but in this community, we're going to have to do this workaround because they operate this way. And we need to make sure that we stay in alignment with what their practices are. Awesome. Anything else you can think of that we want to add to this one? That pretty much covers the four bullets that we had underneath this one from the key findings. So everybody wants more money. It's just always tough to get it and then figure out how to use it without it getting chomped down on for not following the line. Think we're ready to close this one out and move on to priority 3, or do you want a couple more
Yes.
minutes to?
No,
Yeah.
I'm all set.
Jen's like, please, please. All right, hold on 2 seconds. We're gonna flip-flop facilitators on you again. Let me just get the screen set up before I share it so I don't make anyone dizzy with scrolling. And I will pass the mic back over to Eliza.
All right, our last one. So we need to take a little smoke to stretch. Last bit of energy. I know this is a lot of, people are usually tired by the time that we're done with these sessions. So our last priority area is programming and structure. So this was expanding programming in public education, which sounds like you're already thinking about with potentially hiring a health educator, thinking about accessibility of services, so meeting people where they're at. And I think that came up a little bit in the first priority area about going to laundromats, going and posting flyers where people go. Languages, thinking about the equitable distribution of resources. So I know, and again, I think we've talked throughout about kind of how things are distributed across the four towns, but thinking about if there's maybe ways you want to approach that when it comes to programming for the four towns. Additional opportunities to increase staffing. So I think we can capture the health educator there. And then more SOPs, so more practices, protocols about our regional work, about threat response. So that could be hacking. It also could be emergency preparedness, capacity and workforce, and responding to urgent needs. So we'll do the same thing we did before, give you a couple minutes to brainstorm individually and think, I know this one is maybe a little bit more, she'll say like amorphous than the others. We're talking about kind of just the programming and structure of Greater Boroughs. But think about what you might want to include in a goal statement for this priority area. So give you a couple minutes and then we'll discuss as a group.
And I just want to interject here. You'll notice there's overlap between these priority areas, and that is completely normal when doing strategic planning. So if you've got ideas, it's okay if they seem a little bit similar to what we have in other priority areas. That will all kind of get teased out as we go along. We'd rather have you include an idea or a concept in more than one priority area and then figure out where to put it later than leave it out and miss it thinking that we might have caught it somewhere else. So it's okay to have this overlap. It'll all make sense as we go along.
All right, take a couple minutes to do your brainstorm and then we'll discuss.
I mean, I think you basically have that already listed of what I was thinking. I mean, our biggest one I know for Westboro is the equitable distribution of resources. And I know explore expanding program in public education. That's a big one. So I feel like you've already listed them all. And I
Very
don't know if our
fair.
brains are tired or what, but that's what I see.
Yeah, I think that's helpful to know that those bullet points are on point. But we'll see if we'll give folks still another minute to brainstorm and just see what people come up with, and maybe we do land on it's what's in the bullet points, but we'll see if people come up with other ideas for what could go in a goal statement.
How about develop regional response protocols? If we have an emergency and it's hitting all, four of us, how does that look like? Or if there's one town that needs more help with an emergency than another, like say Southborough has a TB outbreak. Our nurses, we need some kind of protocol on how that works.
Are folks ready to discuss as a group, or would you like some more time for individual
Oh,
brainstorming?
sorry. I was
That's
thinking
okay.
out loud.
Some people are external processors, some are internal. But just wanted to check and see would people like would anyone like more time, or are folks ready?
I'm all set.
Okay. Well, thank you for kicking us off, Jen, of develop regional response protocols. What else are people thinking about?
I think in that same vein, kind of clearly outlining or just like having a clear picture of how the Greater Boroughs partners with health departments in terms of programming and education of kind of how that relationship works. I think we have again, we already do it every day, but I think having that written down somewhere, kind of formalized in some way.
Strengthen regional collaboration.
Yeah, so you want maybe a little more clarity or processes just to kind of strengthen the way that you work together, that there's that shared expectation or understanding.
Yeah, I like the phrase the shared expectations of being clear about kind of who's expecting what from whom.
Yes.
What else were people thinking about? Or are there some of those bullets under that we came up with from the key findings that you want to make sure are in the brainstorm?
Yes.
All of the above.
Well, definitely accessibility of services. The equitable distribution of services. Additional staffing would be wonderful.
Yeah. And that's one, there's probably some overlap with the funding and sustainability for that one, just that you'll need the funding in place to be able to hire folks.
Expanding on accessibility of services where it says languages available. I think looking into, I think at this point, most municipalities have pocket dogs. They're okay. But I personally like better when we had access to a language line. Because I just feel like having a person that's able to speak to them in their own language is much more beneficial than having just something translate that you don't know if it's accurately translating or not.
Got it. You said
So
pocket
maybe look
doc or dogs?
Pocket Talk.
Pocket Talk. Okay, got it. And is it one of those like it'll translate
Translator.
in real time, but you
Exactly. And it has a lot of languages, which is super helpful, but I personally just like the use of an actual person on the other end of the line.
yeah.
Pocket Tot
And
that's like one step better than using Google Translate, right?
exactly.
That makes sense.
The other thing that I was thinking about when we're talking about establishing protocols, like if, for example, hacking, like working with IT to see if they already have something developed and then
Mm-hmm.
making it just specific for public health.
Yep.
Let's
Working
not
with
reinvent the
IT.
wheel.
Yeah, would that be the IT for the different town departments?
Yeah.
In terms of how we might form a goal statement, I'm thinking for this one, it might be, or want to think about how we're going to capture all these different pieces where we have accessibility, we have IT, we have language, and protocols. I'm wondering if it might be something that kind of looks like the structure, um, and programming of Greater Boroughs meets the needs of the four constituent communities, or it might be something a little more broad like that.
I think one of the themes that comes to mind are like words is like seamless. Like the goal would be to
Mm.
have seamless services as much as
Mhm.
possible.
Or
Yeah,
streamlined.
streamlined, seamless. Maybe it's something like the structure of the Greater Boroughs supports streamlined and seamless services or something like that.
Or strengthen. I feel like that should be.
Instead of supports.
I feel like we already support.
You want it to be a little more aspirational that you're already doing that. So how do you, yeah.
I also think adding maybe at the end or like the structure of GB strengthens, streamlined, seamless services and collaboration.
Hmm. The structure of strengthened, streamlined, seamless services and collaboration. Are you thinking collaboration like between the four towns or with your partners?
Between the four, I believe.
Mm. Yeah. I feel like there's a way I want to try to like almost like reformulate the sentence, but I haven't quite landed on it. So folks, take a minute, maybe look at it and see what you can come up with.
The Greater Boroughs structure strengthens and streamlines seamless services and collaboration.
Is it in collaboration or and collaboration?
and
So we have the Greater Boroughs structure strengthens and streamlines seamless services and collaboration.
I mean, I'm not in love with it, so
Right? It feels like not quite there.
no.
Feels like a tongue twister with all the
Yeah.
S's.
Yes, yeah. Say that 5
There's so
times
many.
fast. Seriously, strengthens, streamline seamless services is an actual tongue twister.
And Sally picks seashells by the seashore.
So
We
I'm
don't have
wondering-
to. I'm sorry. Go ahead, Eliza.
Go ahead. No, go ahead, Donna.
I was going to say I don't think we have to say the word structure in here. We could say
Program or
just
collaborative
something that so like the Greater Boroughs
partnership for health strengthens and streamlines
Yeah, we could just say Greater
services and
Boroughs.
collaboration.
Mm-hmm.
I don't think we need to have.
We could say that Greater Boroughs Partnership for Health strengthens and streamlines. Still have the tongue twister element to it.
I'm thinking
Strengthens and
seamless
streamlines.
needs to go.
What
I
about
get it.
what about unified services?
Instead of seamless, maybe.
Or
Or
Greater Boroughs
consistent?
Partnership strengthens and streamlines unified services and collaboration.
oh, I like that. Unified is good. I like that.
It
Gets
rolls
one
off
of
the
the
tongue a
S's out
little
of there
better.
for sure. A little less Sally with seashells by the seashore.
Greater Boroughs Health strengthens and streamlines
Unified
public
services.
health services.
Yeah.
No.
You wanna
Unified
add-
services and collaboration of public health or of public health. I feel like that does make sense now either.
There's the Greater Boroughs Partnership for Health strengthens and streamlines unified public health services and collaboration.
I feel like collaboration needs to move.
I was gonna say, it feels like it's
services.
hanging on at the end there.
Yeah.
So extreme.
So maybe,
How about strengthens collaboration and coordinates streamlined, unified?
Because well, basically it sounds like we want to get at that you're better, that kind of way that you're working with each other. You have a little more structure, those shared expectations. So you're speaking, but I wonder if maybe the streamlined and unified captures that.
How about the Greater Boroughs Partnership for Health collaboration strengthens and streamlines?
Yeah. I was gonna say, I think streamlines and unified maybe speaks to you're going to be streamlined and unified if you're all kind of well collaborating
That's what I was
well.
thinking. Right.
So you may not even need it.
Do you
Yeah,
want to
but
say
it's not
services
right.
and programming, or is programming implied in services?
No, services and programming.
I'm sorry, somebody else was about to say something. I hopped on them.
I don't know. I think collaboration, it sounds good because it's in there and we're working together. But I think the partnership for health is what that collaboration is. So I'm not even sure if we need collaboration, even though I like the word.
Let's try without. So it would be the Greater Boroughs Partnership for Health strengthens and streamlines unified public health services and programming.
Through collaboration?
Yeah, you could say through collaboration. I could also see something like across the 4 towns, just to get at like.
Through collaboration of our 4 communities.
Mhm.
Between our 4 communities.
Within.
Through collaboration
Within.
within our 4 communities. So the Greater
Better.
Greater Boroughs strengthens and streamlines unified public health services and programming through collaboration within our 4 communities.
I don't want to limit us to say our 4 communities. I mean, I know that's what it is, but I would just say maybe our communities.
Within our communities.
Instead of within, maybe among. I don't know what word would be better.
I'm dying
What
to
if-
pull up Google
think
on
if
this
you-
one, but
if
it would
you-
overrate this.
If you when we got rid of 4, you could go back to, and I don't know who said this originally, but maybe across our communities. I know
Mhm.
that was on the table and we deleted it.
What if it was the GBPH or the Greater Boroughs Partnership for Health collaborates across our communities to strengthen and provide unified public health services and
Mm.
programming?
So flip the order there. Collaborates across our communities to strengthen and streamline unified public health services and programming. I like that change. And then you get rid of, yeah, there we go. What do you think? Feels better than where we started, for sure.
For sure.
Sometimes you hit it on the second iteration, sometimes it takes a half dozen or more, so. So how does that, so if we took this and we put it down and made this. How does it feel with this trio? Does that feel good? So this were our.
Feel good moving forward with that. And again, we can always tweak the next time we meet, tweak the goal statement.
I just feel like there's so many words on 3.
Yeah, it feels still a little clunky.
Yeah.
It's actually the
So the
shortest
Greater
one,
Boroughs-
but yeah, it feels like a lot of words.
Greater Boroughs collaborates across our communities to strengthen and streamline unified public
I'm
health
thinking
services.
unified. I don't like that word, unified. I feel
Yeah,
like
now
it's
that
a
we have
different word.
collaborates, maybe we could even take it out to strengthen and streamline public health services and programming.
Yeah, I just think unified. I don't like that word there.
People okay
That's
with taking
me.
that out? Or some might argue to keep it in. Makes it one word less
I mean, I
clunky.
understand that's what we do. It's unified. It's what we're doing. I just feel like if we're going to put it somewhere, it needs to go somewhere else.
Yeah, and I think where you're leading with collaborates on that draft goal statement now, I think it gets at that unified, you're collaborating. So maybe you don't need to state it again. So the Greater Boroughs collaborates across our communities to strengthen and streamline public health services and programming.
How about the Greater Boroughs Partnership for Health unifies our community to strengthen, no, by strengthening and streamlining public health services and programming.
What are you changing in there?
I don't know now.
Michaela, go ahead. Are you going to say something?
I think removing unified, even though we are unified, I think it makes it flow better. It kind of is starting to feel with that, like we're adding too many words, like you need to meet a word count and you're adding too many descriptors.
Right.
Totally. You just keep adding adjectives to try and hit that word count. Yeah, I think this is a good, unless people are like, oh, it's really not sitting well still, I think this is a good place to leave it as a draft goal statement. Again, knowing that you can come back to it and make changes. What do you think?
I think that's a great idea.
Also recognizing, I know we're kind of reaching maybe a point of we've been working on goal statements. Yeah.
Mental saturation has been achieved.
Yeah.
So we can round out. I know we've already done a little brainstorming for this priority area, but just to capture anything else that you could see doing in this priority area to try and achieve that goal.
I still think that the whole sharing information
Mm-hmm.
as a group is helpful because that's what we're trying to do, right? We're trying
Sharing
to,
information. Mm-hmm.
Yes, I agree.
What about data? Do you all have kind of protocols? I know Michaela is the epidemiologist for Greater Boroughs, but how you maybe approach sharing town data?
I don't know if we have a set protocol. I generally follow like the state has guidance in terms of small numbers and things like that that we follow. But yeah, I think that could be an option. I also think in that kind of sharing and data piece, thinking about like program development and what our basis for
Mm.
developing programs is slash might be in terms of looking at the data and what works and
Mhm.
evaluating programs. I think that's already come up somewhere else, but um, in that like assessing what works and what doesn't and kind of how we go about that.
Mhm. Yeah, that makes sense. Because I think we talked about it maybe on the first, or maybe it was funding, I forget, but talking about being able to track outcomes to then justify funding. So that ties into the evaluation part of it.
What else?
There was something about meeting people where they are, I think is one of the bullet points. Oh, that was accessibility of services. But I don't know if that's something like you would want to kind of assess the current accessibility of services.
well, we kind of, I think, are trying to do that when we do offer home visits. And
Mhm.
so, I mean, I think it's not utilized enough.
So maybe promoting some of the services you already offer.
Mhm. I also don't want to overload everyone. Like doing this
True.
is great, but one of my concerns is
Yeah.
overloading our staff and, you know, that's not what we want to do. So that's a concern.
Yeah, you
That's
don't
a
want
good.
to, you
I
don't want to
wonder
have,
if
go ahead.
I was just gonna say, I wonder, that's a great point. And I think there was something around capacity. Oh, establishing practices and protocols around capacity and workforce. So being able also to say, oh, there's this opportunity over here, but we don't have the capacity to maybe do X, Y, part of it.
Yeah,
Sorry,
you
go
want to
ahead,
promote
Summer.
it and go from like 5 home visits to 10 home visits, not go from
Exactly.
5 to 137.
Right.
Mhm. What about if there's any like partnerships you might do? Like if I think I remember from the key findings, one that came up was like working with first responders or partnering more with some of the first responders, like around um, hoarding was one area where that's kind of there's a crossover where it comes up for first responders, and then also for the concern for inspectors. So kind of identifying areas where you might be able to partner.
I can't tell if folks are unenthusiastic about that idea or if they are just.
I think hoarding in itself, we're not enthused.
As a topic.
Time and I mean, I believe we do, it is a crossover, but we communicate about it. It's just, we don't have, that's again, a capacity. What health director here has the capacity to reach all our hoarders in our town?
No.
That's impossible.
Yeah, and I think maybe thinking about, it's not to say that you aren't doing the work that you need to be around hoarding, but if there's like more opportunities to maybe how you coordinate with the first responders or coordinate with emergency services, are there ways to, things you can identify to better coordinate some of those things?
I think this one is more town to town specific. And it's definitely true across like the Commonwealth, but like I have a great relationship and there's not really a barrier between my police and fire departments, like first responders and public health, and like there is in other communities. So like I think this would be something that's more focused on like what communities need that bridge, which in my opinion I don't, but
I don't either. I think ours is just more concerned that it's not happening.
right. But there also has to be a willingness there too. And
Right.
I mean, we just had 3 hoarding cases in the past 2 weeks and all of them told us to get lost. So,
I think too, like this discussion is making me think of like a scope of work for, I know this has been under works for like public health nurses and different positions in local public health, but thinking about our organization as like Greater Boroughs of like what is our scope of work within health departments to help coordinate, but also establishing like what are the limits of the capacity right now, or like where do we hand off to other organizations that might be better equipped to deal with not just hoarding, but like other issues.
Yeah, that's a great point. Anything else for this priority area that you can think of? Are people pretty keen to maybe wrap for today? Which is understandable.
Virtual meetings
All
can be
right.
so much more exhausting when they're long.
Yeah, I think we can maybe move into reviewing next steps. So thank you all so much today. I know, as we're going through, it can feel like a bit of a slog of drafting multiple goal statements and doing a lot of that like brainstorming work. The next time we meet, you'll have more to kind of look at and react to. So we're going to take all of the great input that we got today, and kind of formulate the plan components for each of those priority areas. So you'll see the next time we meet, there'll be the goal statement you drafted, and then we'll kind of propose some objective statements and strategies, and then be able to work through that as a group, look at that as a group and make any changes, edits. Sometimes you need a little time and a good night's sleep, and you look at it again, you're like, oh, how could we have forgot this strategy? So we'll be able to do that. for each of the priority areas. And then at the end of that session, which will be Monday, June 1st, 11 to 2, you'll have your plan, your draft plan. And after that, we'll do a feedback round. There'll be some revision before we get to the final plan. But essentially, we'll have the bones of the plan by the end of the next time we meet. Any questions or anything? Again, thank you all so much today for your input and brainstorming.
If you do think of anything else that you're like, oh, I wish I had included that, feel free to drop Eliza an email and let her know, and we will take that into consideration as we're synthesizing all of this next week to get it ready for the 1st.
Great, thank you so much.
Yeah, thank you all. That's
Thank
it
you.
for us, but go
Thank
ahead.
you.
Have a nice weekend, everybody.
I move
Yes,
to
enjoy the holiday
adjourn the
weekend. Be
meeting.
safe, be healthy.
I move to adjourn the meeting at 2:31 p.m.
Second, vote aye, Taylor from Southborough.
Yes, Anne Marie Boylston.
And I, Jen Sullivan, Westboro. Thank you so much.
Thanks. Bye.
Thanks, everyone.